another episode. Today we're diving into a game-changing topic: how artificial intelligence is transforming healthcare. This isn't some vague sci-fi future, it's happening right now. From diagnosing diseases to helping develop new drugs, AI is already becoming the assistant every doctor wishes they had, and the second opinion every patient deserves. So grab your curiosity and let's scrub in. Let's start at the front lines: diagnosis. Traditionally, a doctor analyzes symptoms, runs tests, checks your history, and tries to match everything to a condition. It's a thoughtful, experienced process, but it's also limited by human capacity. We're great at pattern recognition, but we're also prone to fatigue, bias, and sometimes just missing stuff. Enter AI. Artificial intelligence, especially machine learning models, can be trained on vast amounts of medical data: X-rays, MRIs, lab results, even doctor's notes. These models learn to spot patterns that may be invisible to even the most experienced specialists. One big success story is in radiology. AI models have been trained on millions of images and can now detect anomalies like tumors or fractures with accuracy that matches or even exceeds human radiologists. And they do it in seconds. That's like giving every radiologist in the world a supercharged brain buddy who never sleeps. But it's not just images. AI is helping spot signs of everything from diabetic retinopathy by scanning retinal images to predicting the likelihood of a patient developing sepsis based on subtle shifts in vital signs that even trained clinicians might overlook. It's like having a guardian angel quietly reviewing your chart, saying, "Hey, something's off. Check this now." Now let's talk about one of the most complex and expensive parts of healthcare: drug development. Creating a new drug takes over a decade and can cost billions of dollars, but AI is speeding up this process in a big way. Think of it like using Google on steroids. Instead of manually testing thousands of compounds in a lab, AI algorithms can simulate how different molecules might interact with a particular protein or cell. This helps narrow down the list of promising candidates much faster. During the COVID-19 pandemic, for instance, AI was used to scan existing drugs for possible repurposing against the virus. What used to take months of lab work could now be done in days on a supercomputer. And when it comes to designing brand new molecules from scratch, AI models like AlphaFold, which cracked the protein folding problem, are giving scientists a massive leg up in understanding how biological structures work. This alone could lead to a revolution in how we treat diseases, especially those that have been stubbornly resistant to current medications. Another fascinating application: personalized medicine. Traditionally, medical treatments are based on what works best for the average patient. But let's face it, none of us are exactly average. Our genetics, lifestyle, and environment all influence how we respond to treatment. AI can analyze your unique data, your genome, your health history, even your wearable tech data, and help tailor a treatment plan that fits you, not some statistical composite. That means more effective treatments, fewer side effects, and better outcomes. AI is also transforming how healthcare systems function on a day-to-day basis. Hospitals are using AI to predict patient admission rates, optimize staffing, and even prevent burnout by streamlining documentation. Doctors spend a shocking amount of time not treating patients, but doing paperwork. AI tools like natural language processing can now listen in on doctor-patient conversations, with consent, automatically transcribe notes, and organize medical records. That's hours of admin time saved, time that can go back into caring for people. And yes, chatbots. Those virtual assistants that pop up when you book an appointment or ask about symptoms. They're getting smarter, and while they won't replace your doctor anytime soon, they can triage patients, give advice on minor ailments, and even schedule follow-ups, taking pressure off overburdened healthcare systems and speeding up access to care. But let's pause and take a breath, because while all this sounds amazing, it's not without its challenges. First and foremost, data privacy. In order for AI to work, it needs data. Lots of it. That means your health records, scans, lab results. Ensuring that this information is stored securely, anonymized properly, and not misused is absolutely critical. We're talking about the most personal data you have. Then there's bias. AI models are only as good as the data they're trained on. If that data underrepresents certain groups, like women, minorities, or people in low-income countries, the AI can inherit those blind spots. That could mean misdiagnoses or poor recommendations for the very people who already face disparities in healthcare. So building fair, inclusive AI isn't just a technical challenge. It's a moral imperative. And finally, there's the human side. Some people worry that AI will replace doctors. But the more likely, and frankly, more exciting, future is one where AI augments human doctors, not replaces them. Imagine your doctor with a tireless encyclopedic assistant who helps double-check diagnoses, flag potential risks, and even stay updated with the latest research. That's not competition. That's collaboration. So, what does this all mean for us, the patients? It means we're stepping into an era where healthcare can be more precise, faster, and more accessible than ever before. It means diseases might be caught before symptoms appear. It means drugs could be custom-made for your body. It means your doctor might spend more time looking you in the eye and less time typing on a screen. But it also means we need to stay vigilant. These tools are powerful, and like any powerful tool, they need to be used responsibly. That means demanding transparency, pushing for equity, and making sure the benefits of AI in healthcare are shared by all, not just the wealthy or tech-savvy. As we wrap up today's episode, here's the big takeaway. AI in healthcare isn't about replacing humans. It's about enhancing them. It's about turning mountains of data into actionable insights, and doing it in a way that brings better care to more people, more fairly. Yes, there are challenges. Yes, there are risks. But with smart regulation, good science, and a human-first approach, the future looks incredibly bright. That's it for today. Take care of yourselves, stay curious, and as always, see you in the next episode.